Welcome to the introduction chapter. I'm Dr. Brandon Horn, and I'm one of the clinicians at the Eastern Center for Complementary Medicine specializing in reproductive medicine. Now, we've specialized in this field for many years, and we've treated thousands of patients, so we have a lot of experience in helping women achieve pregnancy. Now, one of the things that we found we were doing a lot is giving people various exercises. These exercises were very powerful in helping to improve overall reproductive function. So we got the idea to just compile the various exercises we've been giving into a series that women could do at home to really help boost their fertility. And because many of the exercises were modifications of yoga poses, it was natural to make them into a yoga series. Now, it's important to understand that these poses are somewhat different than normal yoga poses. And the reason for this is that we had to modify the poses to optimize them for fertility. It's also useful to know that these sets have been used clinically, and we've seen excellent results with their use. Okay, so let's talk a little bit about the video itself. Now, you'll notice that there are 3 instructors, and that each instructor may hold a particular pose differently. Now, this was done on purpose to show variations that you can use depending on your flexibility. Now, keep in mind as you go through the sets, you really don't need to be able to twist yourself into a pretzel in order to have beneficial effects. Just respect your limitations and don't do anything that's uncomfortable for you. Now, before you begin using the DVD, it's helpful to have some overall context. So the remainder of this introduction is going to be dedicated to helping you understand some of the general concepts we're using and also to help you more effectively utilize the sets. Okay, so let's begin by looking at what we mean by yoga for restoring fertility. Now, the word yoga means to unite. And what we unite with are the mechanisms that you already have in you. So the good news is we don't need to go out to get anything to make us fertile. We already have that code built in. What we need to do is reset the mechanisms to restore our inborn reproductive capacity. Now, if you think about it, you yourself are the result of millions of years of successful fertility. So you're really living proof of your innate reproductive capacity. So the next question is, what goes wrong? And what mechanisms are in place that we can actually work with to restore fertility? And the answer in large part is your menstrual cycle. So the first thing we need to do is really have an understanding of what's happening with the menstrual cycle and how we can work with that. So basically, your menstrual cycle has 4 phases. These are the menstrual phase, the follicular phase, the ovulatory phase, and the luteal phase. Now, fertility and your cycle begin with menstruation. Why? Because menstruation is the time when you're cleaning house to begin preparing a home for a fetus. Basically, when you're bleeding, you shed the old lining of the uterus, and if menstruation is successful, you start with a clean slate. So during this time, we need to help the body facilitate cleaning and getting rid of things. So what you need to know as well is that you have to be very careful when exercising during this time, because you can potentially cause a lot of long-term problems for your fertility and for your overall health. So we had to very carefully design this phase to avoid any problematic exercises and poses. So next we have the follicular phase, which starts after your period. Now, some people say it begins with your period, but for our purposes here, you begin follicular phase yoga the day after your bleeding stops completely. In other words, if you're still spotting, then you should still be doing the menstrual phase yoga. Now, during the follicular phase, your follicles begin to grow. And you can think of follicles somewhat like small bubbles that have eggs maturing inside. And while these are growing, your uterine lining is also beginning to thicken. Now, this helps to make a nice home for a fertilized egg. So you can see that during this phase, we need to focus the body's energy on building, which is essentially the opposite of what we're trying to do during the menstrual phase. So during the follicular phase, we have to use a completely different treatment principle. Now, the follicular phase essentially ends in the process of ovulation, and although technically speaking ovulation is more of an event than a phase, for our purposes it's better to think of it as a phase. Basically, during ovulation, the follicle sort of breaks open. In actuality, enzymes are eating a hole into it, but regardless, the egg comes out and it gets grabbed by the fallopian tubes, and then it begins its journey down the tubes. So to support this process, we're no longer trying to make things grow, we're trying to help the body break things down and move them along. And again, this is a very different treatment principle than what we use during the menstrual or the follicular phases. Okay, so we recommend that you begin the ovulatory phase of this series on day 10. And to calculate which day is day 10, we start with day 1 as the first day you have flow and not just spotting. And then you stop doing the ovulatory phase 48 hours after an ovulatory predictor kit reads positive. If you're not using a kit, then the last day of ovulatory yoga should be day 14. Now you can review this information on our website, www.restoringfertility.com, and the username and password should be on the back of the DVD cover. Now, one other very important thing to mention is that you should be having intercourse at least every other day from day 10 through 2 days after your ovulation kit reads positive. So if your surge was on day 12, then you should have intercourse on days 10, 12, and 14 at the very least. And of course you can do more, but again, that's a minimum recommendation. Now, in fact, it's best to actually follow your natural libido cycles and have intercourse when your sex drive's high. And if your drive's not good, then it should start picking up a few months after beginning to do this series. Okay, so finally we're in the 4th phase that we call the luteal phase. In this phase, the sperm will hopefully find an egg and an embryo is formed. Now this actually happens in the fallopian tubes, and then the resulting embryo, which is called a zygote at this point, moves into the uterus where it begins to attach itself to the lining. Now the travel time down the fallopian tubes is generally 1 to 2 weeks. And during this time, it's important to facilitate that movement to help avoid complications, for example, ectopic pregnancies. Now, once you get a positive pregnancy test, you should discontinue this yoga series and move to a prenatal yoga series. Also, if you begin spotting toward the latter part of your luteal phase, you should take a rest from practicing yoga and only begin menstrual phase yoga if your flow begins. If not, be sure to take a pregnancy test because it could be implantation spotting. So we can see how the body has a relatively complicated and impressive mechanism in place to promote fertility. And we can also see how specific we need to be with the type of treatment principle we apply in each of the 4 phases. Now, once you begin doing the various yoga sets, notice how each of the sets makes you feel. Okay, so let's talk a little bit about one of the most important aspects of fertility, and that's energy. Now, anything that happens in your body requires energy. Life can't exist, and none of your organs or reproductive system can function without it. It's what makes your follicles grow, it's what makes you ovulate, it's what drives the entire process of implantation and embryo growth. So if you don't have optimal energy, be it production or delivery, you don't have an optimal reproductive system. Now, energy is produced in the body through small factories we call mitochondria. And if we look at the amount of energy factories we have per cell, we get some idea of how important it is in reproduction. So consider this. The amount of mitochondria in a heart cell, which has to move constantly through your entire life, is about 3,000. Now that's a lot of energy packed into one cell, but it pales in comparison to the energy requirement of an oocyte or egg cell, which requires up to 500,000 mitochondria. Now with energy, it's not just about quantity. Equally important is getting the energy to where you need it. And this entire system of energy production and delivery, unfortunately, is not well addressed in conventional medicine. But in contrast, energy production and delivery are major components in Chinese medicine, and methods for improving this process have been researched and refined over literally thousands of years. And what the Chinese discovered was that energy travels through the body in a network of streams that we call meridians or channels, and along these channels are areas where the energy gathers. And these areas we refer to as acupuncture points. Now, acupuncture points are like dams that control the flow of energy. We can increase energy in one place, and we can decrease it in another. We can also control the timing of when the energy flows where. So when you do the poses in these yoga sets, it's worthwhile to take the time to get to know the acupuncture points that we're using, because they're a very important part of the sets. If you're not familiar with them, or you feel they weren't explained well enough within the video, then we have diagrams of them on our website. Now, there are over 50 different channels in the body, and some tend to be more influential for fertility. So, for example, there's one called the penetrating vessel, and this is one of the 8 extraordinary meridians. Now, this is one of the channels that governs DNA expression, so as you can imagine, this is extremely important for the treatment of infertility, since all development requires appropriate genetic expression. Now, the penetrating vessel is very interesting. A good portion of it overlaps with the stomach channel, at least one portion of it overlaps with the stomach channel, and it represents how important the digestive system and nutrition are in the preservation and proper maintenance of DNA.